Unit 5, Medical Practitioners. Exercise. 5.1. Write sentences to describe the work of the specialist in each brand of medicine. Look at B opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist specializes in diseases of the immune system. Traumatology. A traumatologist specializes in the treatment of severe injuries. Pediatrics. A pediatrician specializes in diseases of children. Obstetrics. An obstetrician specializes in partums and postpartum. 5.2. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, specialize, noun, person, specialist, noun, activity or thing, specialization. Verb, practice, practitioner, is the noun, person, non-activity or thing, practice. Consult is the verb, consult is the noun, person, consultation, the noun, activity or thing. Verb, assist, noun, person, assistant, noun, activity or thing, assistance. Verb, graduate, noun, person, graduated, noun, activity or thing, graduation. Verb, qualify, noun, person, qualifier, noun, activity or thing, qualification. 5.3. Find prepositions in C opposite that can be used to make words combination with the words in the box. Then use the correct forms of the words to complete the sentences. The words in the box are good, interest, specialized, and work. 1. A pathologist specializes in diagnosing disease through examining cells and tissue. 2. A pediatrician must enjoy working with children. 3. An oncologist is a specialist in the diagnosis and treatment of cancer. 4. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. 5.4. Make word combination using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. 1. Health center. B. 2. Group practice. C. Surgical specialties. D. General practitioners. I meant to say 4. 5. Consulting rooms. And 6. Internal medicine. Unit 6, Medical Practitioner 2. 6.1. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate specialists, house officer, on call, provisional diagnosis, radio pager, were on. Say 6.2. Match the descriptions 1 to 5 with the job titles. A to E. Look at A and B opposite to help you. 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating children admitted to ward 16. That is C, a consultant. 2. Dr. Stewart has just started the second year of her foundation program. That is B, HHO. 3. Dr. Stein has started his training as a surgeon. A specialist registrar. 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. E, PRHO or house officer. And 5. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. B, a medical director. 6.3. Are the following statements true or false? Find reason for your answers in A, B, and C opposite. 1. A medical graduate becomes registered 2 years after graduation. False. 2. The system of training doctors in Britain is called the Foundation Program. True. 3. The name senior house officer is no longer used in Britain. False. 4. The consultant is usually the first doctor to see new patients. False. 5. When working in shifts, all doctors take turns to be on call. False. 6.4. Complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Thursday and Friday morning, the consultant does her work round, and I have to make sure I'm completely up to date on her patients. After that, there are usually a lot of things to do, like writing up request form for blood tests, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home, and then, of course, there are the lectures and the tutorials in the foundation program on Monday and Wednesday. Unit 7, Nurses. 7.1, complete the sentences. Look at B and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support nurse. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a shared nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. 7.2, make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out a procedure, change a dressing, check the temperature, give an injection, remove sutures. 7.3, complete the sentences with the correct grammatical form of perform. An isotope brain scan is painless and easy procedure. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. 7.4, complete the sentences with the correct grammatical form of carry out. I now intend to carry out a larger study. Unfortunately, few properly controlled trials was carried out so far. A number of studies was carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. 8. Allied health professionals. 8.1. Make word combinations using a word from each box. Look at A, B, C, and the opposite to help you. Occupational therapist, social worker, artificial limb, contact lens, health professional, intraocular pressure, club foot, which 8.2, which allied health professionals who best help the following people. Look at A, B, C, and D opposite to help you. A young unmarried woman who has just had a baby. Social worker. A woman who is having a difficulty using her right arm following a fracture. Occupational therapist. Someone who needs glasses. Obstetricians. An elderly woman who has had a below-knee amputation. Prosthetics. A man whose wife has Alzheimer's disease. Occupational therapist. A man with a fungal infection of his feet. Chiropodist. 8.3. Complete the text. Look at A and see opposite to help you. A prosthetics works with patients of all ages as a member of a clinical team based at a large hospital. The patients might need a prosthetics as the result of an accident or an amputation following a disease such as diabetes. Alternatively, they might have been born without a limb. Orthotists work alongside doctors, nurses, psychotherapists, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as a part of an outpatient service and also visit other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy might require an orthosis to help them walk, and many other people need special shoes to correct posture. If damaged, any part of the human skeleton might require some form of orthosis. The orthosis might be needed to reposition the body or to relieve pain. Unit 9, Hospitals. 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, admit. Noun, admission. Verb, assess. Noun, assessment. Verb, discharge. Noun, discharge. Verb, operate. Noun, operation. Verb, refer. Noun, referral. Treat is the verb and the noun is treatment. 9.2. Make word combinations using a word from each box. Look at C opposite to help you. Acutely ill, referral letter, assessment unit, on duty, waiting list. 9.3. Which hospital departments will be most appropriate for the following patients? Look at A, B, and C opposite to help you. A woman in a diabetic coma, intensive care unit, a patient who has just had a radical prostatectomy, surgical high dependency unit, a patient who is to have a skin lesion removed, day surgery unit, a man with a foreign body in his eye, the accident and emergency department, a woman with a treated abortion, maternity, emergency. 9.4. Complete the extract from an information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the clinic, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You might need to have some tests done, such as an X-ray, which could mean going to another department, or you might be referred to other professionals, such as a physiotherapist or dietitian. You might need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for outpatient surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Unit 10, Primary Care. 10.1, complete the sentences. Look at A opposite to help you. Children over 6 and people with some chronic diseases do not have to pay prescription charges in the UK. Patients with mobility problems might be unable to go out, they are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out-of-hours treatment, OAOH. 10.2. Make word combinations using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. Take messages, make appointments, change dresses, refer a patient, supervise a clinic, perform a minor surgery, run home visits. 10.3. Which member of a practice team will be responsible for each of the following? Look at B opposite to help you. Running a clinic for pregnant women, midwives, teaching a patient how to straighten his broken leg, physiotherapists, letting the GP know that a patient can come to her appointment, receptionist, running a clinic for people who want to lose weight, general practitioner, or GP. Visiting a patient who has just returned home after a hernia operation, district nurses, carrying out checkups on children in a poor neighborhood, health visitors, organizing cover for an absent doctor, primary care trust. 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. From 1 o'clock to 2 o'clock p.m., the practice team meeting over sandwich lunch. From 2 to 4 o'clock p.m. afternoon, surgery, 10 minutes appointment. From 4 to 4:20 p.m. coffee break. From 4:20 to 5 o'clock p.m. shake with receptionist for messages. Deal with home visits and repeat prescription requests. 5 to 6 p.m. paperwork, referrals to secondary care, admin tax, telephone calls to patients, private medical examinations. And on 6 o'clock p.m., phones switched to OOH service. Unit 11, Medical Education 1. 11.1. Match these activities to the stage of medical education in the UK, given in A opposite. Dissecting cadavers, undergraduate, keeping a log of surgical procedures observed and performed. Postgraduate, keep working for 4 months in accident and emergency to experience this specialty. Foundation program, taking a 4-week attachment in obstetrics and gynecology. Undergraduate, taking an online course on recent developments in cardiovascular diseases. Continuing professional development. 11.2. Complete the sentences. Look at B and C opposite to help you. Just before their final year, students have the chance to take an overseas elective in a hospital of their choice anywhere in the world. Problem-based learning constructs with an approach where each subject is done separately. These days, lectures are often interactive, with regular opportunities for the students to ask questions. In clinical attachments, students learn how to treat and manage patients. Student-selected models can be a topic for outside medicine, such as a foreign language. The dissections of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh, they from 105 of 1505. We have a seminar each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. Julie spends 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old man. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver dissections. Otto spends a month working in the pediatrics ward of the local hospital, vocational studies and clinical skills. And Anne learns how to take blood from an elderly patient's seminar. Yuma chooses to study travel medicine in his 4th year. Students selected models. Unit 12, Medical Education 2. 12.1. Complete the phrases with verbs from the box. Two phrases can be completed in two different ways. Look at A and B opposite to help you. As the words in the box are assess, deliver, demonstrate, provide, supervise, and take. 1. Demonstrate a competence or how to do something. 2. Supervise a trainee by ensuring she successfully completes her training. 3. Provide a course or a training program as a teacher. 4. Take a course or a training program as a student. 5. Demonstrate progress or competence. 12.2. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1. An AFG1 is a doctor. D. In the first year of the foundation program. 2. A demonstrator is an anatomy teacher. H. Who teach this section. 3. A clinical trainer is a consultant. F. Who provides training during periods of direct clinical care. 4. A supervisor is a consultant. B. Responsible for the training program of a trainee. 5. A medical school is. G. A part of a university responsible for medical education. 6. A placement is. C. A period spent as a trainee in a hospital or in general practice. 7. A college is. A. A body of specialists responsible for delivering and assessing training interspecialty. 8. A fellow is a specialist. E. Who has reached the highest level interspecialty. 12.3. Write in full the qualification of the doctors and surgeons. Look at C opposite to help you. Mr. A, age June husband, MBCHB, FRCS, FRCST, Bachelor of Medicine, Bachelor of Surgery, member of the Royal College of Physicians. 2. Dr. C. Doyle, BMed, BMed SCI, BMR, MRCP, Bachelor of Medical Sciences, Doctor in Medicine, member of the Royal College of Physicians. 3. Miss E. Inglis, MBBS, FRCS, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of England. Dr. E. Merriweather, BMD, FRCP, Bachelor of Medicine, Medical Sciences, Doctor in Medicine, Fellow of the Royal College of England. Unit 13, the Overseas Doctor. 13.1. What kind of a registration Might this doctor obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor, limited registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, AG1, full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist register posts. A specialist registration. 13.2. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Score. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol: airways, breathing, and circulation. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. 13.3, complete the test. Look at A, B, and C opposite to help you. My name is Musa, and I came from Yemen. I came to the UK about 2 years ago after graduation because Yemen is outside of the EEA. I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling patients, you shouldn't simply memorize a set of phrases. It's better to really think about what you are saying to the actor and get the intonation right. After completing my years of clinical training, I was able to obtain full registration, but I found it difficult to get an HO post in my chosen specialty, pediatrics. As hospital now have to demonstrate there isn't a suitable candidate from the EEA. Once I be completed my second foundation year, I should obtain a OSCA, which will allow me to proceed to a special registration with the GMC, an important step on the road to becoming a pediatric consultant.